What's up, YouTube? Dr. McIntosh here with Health and Performance Center. I wanted to hop on here and make part 2 for impingement. Enjoy. So again, this is impingement part 2. I'm Dr. McIntosh with Health and Performance Center in St. Louis. So let's talk about some objectives for this video. Number 1, I want you guys to understand how impingement is diagnosed. Number 2, we'll discuss some reliability of testing and whether or not I think further testing is needed. And then 2, we'll kind of set the stage for what's next. So, number 1, how it's diagnosed. Well, you kind of have to have pain in or on your shoulder to start with impingement. Number 2, if you have true impingement, you really have trouble lifting your shoulder, because when you lift the shoulder after about 45 degrees, there is a serious pinching in the space and all the soft tissue under the acromion process. So that's kind of this area in your shoulder. So if you can't lift your shoulder very high, you might have true impingement. Otherwise, you probably have a rotator cuff tear, probably of the supraspinatus. We'll talk more about that later. Now, what you need to do is find somebody who can group some orthopedic tests together, what we call a cluster, and you really need 3 of those to be positive. Here are the most likely ones that should be done. A painful arc, which is more of a history and observational finding. When you lift your arm from your side, it should hurt for about 15 to 20 degrees. The pain should go away. And then once you abduct or lift your arm up above 90 degrees, it should hurt again. That's called a painful arc. Hawkins-Kennedy test is another one where your elbow is kind of out in front of you and you're externally rotating your arm, basically testing the integrity of that rotator cuff. Near, drop arm, empty can, and the external rotation lag sign. If any of the 3 of those are positive, chances are high that you have some type of rotator cuff pathology. Next, why do you do a cluster? Why does it have to be more than one? Well, one orthopedic test is pretty much worthless. It doesn't tell you a whole lot. And 2, you need to be matching things up, right? The subjective answer of the patient after the orthopedic test has been administered. You combine multiple subjective responses in a row that match up with the history of what's going on in your shoulder. Then you can kind of collectively make a diagnosis in your head about what you think's going on. And of those, all the ones that we mentioned on the most previous slide, I think painful arc pretty much needs to be in there based on the mechanism of the supraspinatus and what it does, which is it basically lifts your arm up for that first between 0 to 15 degrees. So if you have pain immediately when you move your arm, chances are you might have a rotator cuff injury. Next, do you need further testing? Well, further testing meaning some type of imaging? No. Up to 30% of people have rotator cuffs and they don't even know they have them. And as you get older, you're more likely to have a rotator cuff tear or some other type of rotator cuff pathology, and you don't even realize it. Most of them are asymptomatic. Now, if you do get imaging, what can it show? So if you get an x-ray, it'll show the superior migration of the humeral head. We'll talk about that in a second. It can show some arthritis of the AC joint and or the shoulder socket itself. It could also show the morphology of the AC joint or the acromion process, like we talked about in part 1. If you get an MRI, it can show you if you have any tears of your rotator cuff, specifically a bursal-sided versus an articular-sided, right? Bursal is on the top, articular side is on the bottom, and then it can show you the level of if you have any tendon retraction from that tear. So, when to pursue medical management. If you have an image showing a full thickness tear, meaning your supraspinatus muscle is totally torn in two. Probably a good idea to get medical management in this scenario. Number two, if your shoulder is causing serious disability, if it is limiting your ability to function in life, probably a good idea to get further medical management. And then number three, if conservative management has failed to improve your symptoms and or disability, well, it's just kind of the natural line of thinking. If one thing fails, you try the next. Now, here are two images I want you to see. Focus on the right image first. It's an x-ray of the shoulder. So as you can see, I've circled there for you what the shoulder joint looks like. And this is a perfect image of what we call superior migration of the humerus. If you have a chronic, long, outstanding rotator cuff tear, you can oftentimes see this, because what the supraspinatus does, when the humerus kind of sits like this and the supraspinatus sits on top of it, it pulls it down and into the shoulder socket, kind of centrates that humerus inside the joint. And if that muscle's torn, well, it can't do one of its main jobs. So then naturally, if it's a chronic thing, you get this superior migration of the humeral head, which you can see on an x-ray. So that's the right image. The left image is a drawing of a full thickness tear. I thought about showing an MRI. I would be able to see what that looks like, but it'd probably be pretty tough for you guys to see exactly what I was trying to show. So this is what happens. You have the supraspinatus comes over the top and attaches to the superior facet of the greater tubercle on the shoulder. And if you have a full thickness tear, it basically means it's torn all the way across. That's what that means. Well, now, what's next? What should you do if you think you have impingement or rotator cuff pathology of some sort? Number one, find a qualified healthcare practitioner who can accurately test your shoulder and talk you through what the exam means. 9 times out of 10, you should avoid taking pharmaceuticals or some type of pain management injection, because it's not going to be better than doing physical therapy, for example. Number 3, 9 times out of 10, you probably should avoid surgery. The results from surgery aren't always that great, and oftentimes you just really don't need it. The idea here is you want to push conservative treatment first. Surgery is always a last line option for the shoulder. So, in summary, impingement, or for the rest of us that don't have true impingement, a rotator cuff tear can be pretty easily diagnosed via an examination from a qualified healthcare practitioner. Number 2, most cases do not need further testing or imaging. You can pretty much get all you need from an orthopedic assessment from a qualified practitioner. And then number 3, most cases should be managed conservatively, that is, i.e. see a chiropractor, physical therapist, etc., because manual therapy and rehab seem to be superior in the management of impingement. Alright guys, stay tuned for more videos talking about the biomechanics of the shoulder. We'll talk about rehab principles, and then we'll walk you through some rehab exercises in future videos. So, thanks for watching.